Welcome to Adapting Class. Quick on-the-go learning. I'll give you a question. You try to work it out. Okay, you have a 35-year-old male. Came in suspected to have schizophrenia, right? We want to know the difference between positive and negative signs to make a diagnosis. So the nurse is trying to figure out which of these are positive and negative signs. What do you think? How would you know this is a positive sign, this is a negative? Because you have to know that, because that's how you can make your diagnosis. Positive and negative signs of schizophrenia. Like this is 1, this is 2, this is 3, 4, 5, 6, 7. Make a diagnosis to be able to tell you whether this is a schizophrenic patient or not. What do you guys think? Which one is a positive sign? Somebody say delusion is a positive sign. Which one is a negative sign? The best way to answer this question is our concept. You have to know that positive signs are classic for schizophrenia and negative signs are not classic. So which one is classic, telling you that individual is having schizophrenia? It's a straightforward question about just content. Disorganized thought, somebody said it's a positive sign. So I'm going with whatever answer choice you say. But on the go learning, how much you know about mental health? Demonstrated with this question, taking schizophrenia. And if I give you a case, you're looking for these words to be able to say, oh, this patient has schizophrenia or not. Lack of energy, somebody say, is a negative sign. So I put it there. Whatever you tell me, I'll put it. Then we go over it and see if you guys are right. So that's what somebody said. Lack of energy is a negative sign. What else? Which one you should worry about? On the go learning, I yield facts about schizophrenia, positive and negative signs. You have to know for your test. Which one else? Apathy. If lack of energy is negative, test taking strategy, apathy will be negative sign. Right. If you have delusion and it's a positive sign, then if you have hallucination, it's to be a positive sign. Now, how about the last two? Psychotherapy, disheveled appearance. Think about it. The way to remember negative sign is they are like signs and symptoms of depression. So negative sign, you can put signs that are looking like depression. And the rest will be positive sign. So which one look like in a depressive episode, we're selecting it. But now I put psychotherapy here and I put disheveled appearance. Psychotherapy is good for negative symptoms. Positive symptoms, you need medication. So it's pharmacology. For positive symptoms, you got to give them medication to treat it. For negative symptoms, usually psychotherapy will help with that. It's a negative symptoms. So this is what your table will look like to be able to distinguish between schizophrenia, the positive and negative symptoms. Okay, that's the first one. So before that, let me please think about the patient is a 50-year-old male asking the nurse about living will or maybe advanced directives. So you got to teach the patient the difference between those two advanced directives, right? So you have a living will. So this is living will here. And here you have power of attorney here. So, serving information straightforward. It's the living will of power of attention. Somebody said living will take effect immediately. Yes, it take effect immediately. You got it. Living will does not need a proxy. So you don't need proxies. Proxies are people who take care, will be taking over your stuff. So you don't need them. They are not proxies. Living wills does not need a proxy, right? So there's no need for proxy for living will. So power of attorney is the one that you need a proxy. And you have to give this to your proxies. In a living will, somebody say give specific instruction. That is true, right? So that's this not this one. In giving to proxies, basically, yes. Both of them has to be prepared by the client. So this is prepared both by the client. And which one can be rescinded? Which one can be rescinded? Both of them have to be prepared. Power of attorney and a living will, you have to sign yourself. So you're preparing the document. Living will, so you're preparing yourself. That's why it's called advanced directive. But which one can be rescinded? Which one do you think? I can rescind whatever I decide. So which one? Is it both of them or one of them? You think about it. Both of them has to be rescinded. And then the last one does not prevent CPR. Does not prevent CPR. Just because you do a living will or power of attorney, rescind means you take it back. To rescind something is to take it back. That's what it means, to rescind it. Just because you sign a living will of power of attorney does not mean like when you need CPR, we're not going to do it. It just tells us that if this is what you need to do, but when you need CPR, it can be rendered unto you unless you say DNR. It's different from this. So it does not prevent CPR, but we can do CPR on it. And if you need additional information, yeah, then you get it. What do they call it? Information about a DNR. So both of them does not prevent CPR. It can be given depending on what your power of attorney says and depending on if you have a DNR information. But just having a living will does not mean that if you fell down right now, I cannot push on your chest unless it specifically say that do not do that and you have requested for DNR orders. So that's the difference between them. Okay, so that's that question. You got to know this information. And then before I go, let me throw some pharmacology there. Okay, Amoxapine. I'll read a little bit of, I don't know, today I decided let's deal with mental health because it's a problem, right? Even not fasting. Maybe Fluphenazine. I give you only 4 quick medications. Oh, this one, add this one to it. I think it's a good one. Three. These are your medication, 5 medication, just 5. 5 medication. Can you recognize them? I label them 1, 2, 3, 4, 5. So you're looking for SNRI, For antipsychotic, we need a TCA, we need a MAOI. Tell me which one is it? That's your first question. That's number one. Number two, which one causes metabolic syndrome? That means it causes diabetes, hyperlipidemia, and then weight gain all together. And then which one you need to avoid thiamine food, and which one you should avoid sumatriptan. And then last one, number six, avoid it in glaucoma. It's a mental health pharmacology. You got to master it, right? Amoxapine is a TCA on the goal line, right? Aripiprazole is a antipsychotic, right? Philosophy is SNRI. Fluphenazine is also antipsychotic. And this one is MOI. You see, that's how you draw the map. It's a concept, right? Among all of them, the one that causes metabolic syndrome, diabetes, hyperlipidemia, weight gain, is philosophy. It's dangerous. You can add fluphenazine to it. Most of the antipsychotic, they causes weight gain, hyperlipidemia, diabetes. SSRI can also do that, but these two are very, very notorious to do that. That's the MOI, this guy, right? And then which one you should avoid? Sumatriptan, the common one. The MOI can do that because it can increases your serotonin, right? This is a concept. Number three can do that because it can also increases your serotonin. Those two guys, when you combine SNRI and this two sumatriptan, we increases your serotonin, you get serotonin syndrome. So those are the ones you should avoid. And the last one, glaucoma, you should avoid the TCA. So we draw a map. It's content, right? Straightforward content. And the last one, I saw somebody say it want a high problem. So I will draw a diagram for you. You tell me what it is. Somebody requested it's a full content on eye pathology that you need to know. So what is A? What is B? What is C? What is D? That is what somebody said. It's a high problem. So what do you think? What is A and what is B? You can see your central vision is gone. You can see your peripheral vision is out. Half of your vision is cut. And then your lens is crowded. What do you think? You say you want high problem. So you got to tell me, what is number one? Which condition will lead to the central vision being lost? Which high problem? Right? Think about it. This is macular degeneration. If your peripheral vision loss, this is glaucoma. This is half of your vision is gone. This is a retinal detachment. And this is cataract. Cloudy lens. Master this content in every high problem, you'll be fine. There's a video on Adapt NCLEX you should check. If you're not subscribed, subscribe to Adapt NCLEX for the undergo learning. Visit out the channel and learn more about NCLEX content. Thank you for patronizing. But this is a content on what? High problem with all the details. And if you notice, every question they're going to ask you, they're going to put all four together. Take care of yourself and have a good day.